Welcome to the Off-Leash podcast with Dr. Pete. I am your co-host, Molly Van Branken, and we're so glad that you joined us for today's show. Remember, we're never here to say what you want us to say. We're just here to be an advocate for your pet.
Amen. Is that what I always say? I think that's what I say. Amen. No.
So...
I never say what people want me to say.
No, you never do.
No. And
it's just, yeah. We just say what we want to say.
A chink in the armor, man.
And sometimes it's not politically correct, but that's okay.
Yep.
That's just how we are.
Yeah.
So we were just talking about, because obviously I've worked at your practice before. I've seen the whole process of what happens when a dog goes to the back. But I don't think a lot of clients know what happens when their dog goes to the back.
We should really kind of walk them through the whole thing and not so much what happens when... let's walk the whole thing from the time you walk in, okay? So you make your appointment, you're walking in, and there's two kinds of dogs in this world, dogs that want to get in there and see the other dogs. Hey, I'm excited. I'm going to the veterinarian's office today.
Not my dog.
I can bark at everybody and see everybody. None of your dogs are happy to go to the veterinarian's office?
No, they hate it.
Okay.
Maybe Stetson doesn't care, but Stetson gets in there and tucks his tail. Sage hates it because she thinks she's getting her nails trimmed.
Sure.
Jade, I think, is too young to know what's happening.
Mm-hmm.
So she's indifferent.
Sure. Well, a lot of dogs want to go in and a lot of dogs don't want to go in. And clients will actually tell you that I drove by your place the other day with our dog. You went to go get a gallon of milk and drove by your place. And the dog was all anxious because we drove by your place. And they'll actually even tell you the story. They come up to this stop sign. If they turn right, they're going to our place. When they go left, they're going to wherever, doggy daycare or something like that, which they enjoy. And so the minute they make the wrong turn, it's like,
oh shit,
that's right. And the dogs are like, oh. So,
I don't like where this is going.
I don't like where this is going. So sometimes, I mean, dealing with the dogs that are unhappy about being there, it's not a big deal. Usually, when you go in the room, you usually get put in a room. First of all, when you come in the door, in most places, I'd hope most places are weighing their dogs as they walk in. And that's an integral part of collecting data. I want to see what this dog weighed 47, 47, 47, 47, 41. Ooh, what happened here? Was
that your Cushing's dog the other day?
No.
Well, no. There was a really chunky dog out in your waiting room. I pet it.
Yeah.
It was cute.
Yep.
It was so cute.
Yep. Anyway, yeah, so we see that right away. So you got to go, and a lot of times the clients don't notice because it's their dog and they see it every day.
Yeah.
And that happens with people. So somebody's wife may lose 15 pounds over the course of a year, and everybody notices except her husband. Yeah, the husband. So anyway, so they come in now, they're anxious and they don't want to go in the room, and some of them want to go right in, some don't want to go right in. But I mean, I see this visible anxiety on some people's face when they have that dog in the clinic because the dog's anxious.
That's me.
And then, so once the dog is anxious, then the people become anxious, and then the more anxious the person gets, the more anxious the dog gets. And
feed off of each other.
So what we really didn't probably talk about to begin with is when you have a dog and it's like, and we have notes in the files that say caution or caution on trimming nails
because they bite or they'll snip.
They bite or and so they go in the room, and most of the time the exam room technicians are taking the temperature and maybe taking at least the pulse rate or the respiration rate. So we're doing those sorts of things, and then by the time I walk in, and my big problem is I'm a little over 6'5".
Yeah.
And so
big dude.
Yeah. So I walk in, and the clients are in a chair with the dog sitting in front of them when I walk in. So the very first thing I do, the dogs are looking at like, what's this idiot doing in here? And it's like, have
you ever had a dog lunge at you?
Oh yeah, all the time. I mean, I remember seeing you 2 years ago, and the next thing I knew, I didn't have my testicles. And so they're not as stupid.
Give them credit.
Yeah, they're actually capable of connecting the dots on some of this stuff. Okay, so some of the dogs and the anxiety builds because the only time they ever come here is to have blood drawn or their nails trimmed or their anal glands squeezed, and So they start to get a bad taste about the place. So what are we going to do about that? Well, there's a lot of things you can do about that. And I guess you could bring your dog down the day we're having a pizza party. Maybe that would give your dog a different view of the whole thing. But
I've seen that before in the waiting room. They give them peanut butter. So they try to make it like a happy
they do that sometimes. Yeah. So we have dogs that are just big dogs that have anxieties. And so we institute what they call the chill protocol, which means you call and say, listen, I got an appointment for Friday or Thursday, and they call on Monday, and I want to get the chill protocol. And that starts with night before some gabapentin and melatonin, and there's all sorts of stuff into it. It's basically the anxious dog version of Long Island iced tea. Mm-hmm. And so they get their Long Island iced tea, and they have it the night before and the morning of, and then they come in and they're not too bad. Yeah, and they're not too bad. And so you've had some really anxious dogs, and really then the staff gets anxious because they remember what happened last time, and are they going to get bit? And that helps. And there's various degrees of this. We have gabapentin, trazodone we use. Sometimes we'll take the edge off, and there's all sorts of things you can do. And in fact, yesterday we had to take X-rays on a dog, and we had to use chemical restraint to do it. Dextrometor, which is a drug that
knocks him out.
Yeah, knocks him out for about 30 minutes, 40
Is it
minutes.
just because the dog won't stop moving, or they're aggressive, or what?
They're aggressive. They don't want to have somebody looking in their ears. They don't want somebody look at what we think is a broken tooth.
Who taught you the chill method?
The technicians learned it at conventions and stuff.
Okay.
Yeah, so it's a kind of an accepted way of doing things, and it's usually an anesthesiologist will say, okay, let's pick some stuff that won't dictate that we can't do anesthesia on this dog when they come in.
Right.
If they're already really anxious and we can't do anything without it being a major thing where they pee and poop all over themselves and everything, we'll give them Dextrometor.
And you charge for that?
Yeah, we charge for that. We ask the client permission to do that. And then,
what if the client says no? Do you just have to do it without it?
Well, sometimes we have to give them a choice of either we're going to do it with Dextrometor or there's a practice down the road that's going to do it. We're not going to do it. Because it's easy.
That's hard.
So the expenses. Well, it's hard on the dog if you don't do it. It's hard on the veterinarians if you don't do it.
Right.
It's hard on the veterinary staff if you don't do it. It's hard on the owner when it doesn't do it. And I see people, they're sweating bullets when they come in. I'm really anxious about being here today. My dog's this and my dog's that. And sometimes I'll look at them and go, listen, I could probably see you in a social setting in a month, and I would not, you'd look familiar, but I couldn't remember who you are. And I said, and you'd be like, remember me? I had the little dog. I had that dog, Zane, and he tried to bite you and blah, blah, blah. And it's like, no, I don't remember that. And I said, if I lose a digit or something, yeah, I'll remember your dog if I lose a digit. I
still see all your digits, so you're doing pretty good.
Yeah. So and what happens is you kind of learn what you can do and learn what you can't do. And then there's always this situation with when you walk in the room. First thing I do is usually sit down, okay? Go from 6'5" to 3'5", and the client's at 2'5". So now we're both about the same height. I'm sitting over there on a stool, and I'm taking a history,
right?
And I'm not looking
engaging with the dog.
Like I'm looking at you right now,
yeah,
and I don't look at the dog. I look at the client, and I say, okay, when did this happen? How did it start? Is it better in the evening than it is in the morning, or is it worse? What month did this start? What's the duration? Is it better now than it was, or is it worse now than it was a week ago?
Right.
And I'm talking to the client. The dog all of a sudden now the dog lays down because it's like this guy's boring.
Yeah.
Yep. Just like the people who are listening to this is like, wow, this guy's boring. So they go, well, this guy's boring. So I become boring. And then, but I still know this dog has anxiety. So if we're going to go ahead and pull the blood, and in the days gone by, years ago, we used to have the clients hang on the dog while we pulled the blood.
Really?
You hang on.
But they don't know how to restrain properly.
No, they don't know how to restrain. And here's the story. I don't know if I want to let this cat out of the bag or not, but I'm responsible when you come into our place. If I do something to your dog, like I give him a rabies vaccine, he turns around and takes your finger off, I'm actually responsible for your finger.
Really?
Yeah. So I got to take that thing and wash it off, sew it back on. But that's a joke. Anyway,
Dang.
yeah. So I'm responsible in a legal standpoint, having not warned you. I'm doing something.
Yeah.
To your dog. It's a procedure, even though it's just a vaccine. It's a procedure.
Yeah.
So then I have to tell people, okay, why don't we go back and we draw. What we do is we draw the blood out of the jugular veins most of the time.
So you got to hold their neck.
Yeah. So
and then their
we
chest.
do that. So we don't want to keep drawing blood out of the front arm because I'll need that front arm someday if something happens and we need to set an IV catheter.
Mm-hmm.
Okay. So I don't want to booger that thing up by drawing blood. And sometimes they pull their leg back and then the vein blows and you got to go with the other leg. You don't want to do that if you can help it. So anyway, we draw the blood out of the jugular vein and people are trained holding the dog back there. So there's hardly anything that ever happens bad. We usually do it when they're on the floor. Sometimes if it's cats or small dogs, we'll do it up on the table. But many dogs are much better when the client's not in the room. And the clients are like, why is that? And I said, well, listen. When I was a kid, we had the Dieterman boys lived next door to me, and I would go over there, and we'd play baseball or whatever. And I said, but if I have dinner with it, or lunch or dinner with the Dietermans, I had good manners because I didn't know what the rules at their house were. And so I wanted to be, hate to say charming, but I tried to be, not Eddie Haskell, where I'm complimenting the mother about how she looks and how her food is. For anybody's who ever watched Leave It to Beaver, that'd be not everybody, obviously. But anyway, the term was always Eddie Haskell. He was sort of a syrupy little kid, young man. Actually, he was like a senior or junior in high school for a long time. Anyway, you want to be a little Eddie Haskell, like you're complimentary. Hey, thanks you for lunch. The hot dog.
Because it's new people.
Well, it's somebody else's house. You don't know whether,
You think that the dogs think like that?
Well, I thought about that, Mr. Dieterman was a nice guy. And Mrs. Dieterman was a nice guy, but I didn't know. But I was at home, I was not that person. And in fact, if the Dietermans met my parents, they said, wow, what a lovely child Pete is. And it's like.
You had them fooled.
Yeah, I had them fooled. That's right. And when my parents quit laughing, they tell him, no, that's the way he is at your house, not the way he is at our house. At our house, he's sort of a jerk. And
your parents are letting it out.
Well, no. Well, I mean,
they're throwing you under the rug.
This is what I'm telling you, that when the dog's in the room with the client, the dog is pretty sure the client will protect him and keep anything from bad happening. So when we go in the back room, we go back to the back room to have the blood drawn, safely drawn. Yep. And the nails safely trimmed and the anal glands safely expressed. And then they come back up. It's they're on their best behavior because they don't know whether anybody back there is psycho or whatever. That they don't know. It's unpredictable as to what will happen if they try something that they might have that if they tried to do something they would have done in the front room. And so I've had that happen. In fact, every once in a while people are really taken by surprise if I go to do something and the dog snaps or something like that. Mm-hmm. That happens about once every 5 weeks or 6 weeks. You'll do something that's like, ooh, that was close. Yeah. Yeah. So you have dogs, and then that happened just, a month or two ago, and the woman was all anxious. And of course, I want to apologize, blah, blah, blah. It's like, listen,
it's fine.
It's no big deal. It's the fight or flight thing. And you think you can read a dog. I couldn't read this one. This was for one thing, it was a golden retriever. So you wouldn't read that dog as being a dog that would snap at you. But it did. Well, and there was little kids in the room. There was all sorts of stuff going on. And you have to kind of stand back and look at the dynamics. You know what I'm saying? Yeah. Okay, so it's little kids and the mother and the father, and the mother's holding on to the dog, and she's telling you about how he never bites. And so you go to do something and he tries to bite. And
I feel like that's always the dogs that people are like, oh, they don't bite.
Yeah.
From my time working there, at least, everyone that we came in the room and they're like, don't worry, they don't bite. And I'd bring it back and I'd say, don't worry, they said that the dog didn't bite. And your technicians were like, that means nothing. Well, that means nothing here.
Well, and when we did large animals, the same way. You go out to somebody's house and they say, well, we want to have our horse checked for pregnancy, which means you put a glove on, a lot of lube, and stick your arm up the horse's rear end. And the clients are telling you, listen, he never kicks. Oh, have you ever put a glove on and stuck it up his rear end or her rear end? I mean,
they will kick.
Yeah, yeah. My guess is if you do something that they're unsure of or unfamiliar with, then you might get clocked.
So
and if you get clocked, you get clocked. And now the whole thing is, you want to try to have your career without big gaps of broken legs and broken arms and broken jaws. So somehow or another, you try to get through life without having anything happen to you.
Yes.
And sometimes that involves chemical restraint. And I think that's the thing I always tell clients, listen, your dog, Bruno, does not want to have anything done back there. And in fact, sometimes will you come back and put the muzzle on Bruno's face and they can't do it. And it's like, okay, he's really out of control today. And yep, he is out of control. So we'll go ahead and give him a little dextometer and anything you want to have done on Bruno, you think he might not want to have done, today's the day to do it. Today's the day to do it. And I said, this will make it easier for Bruno. This will make it easier for you because I think you have anxieties now that you've watched Bruno doing this. It's going to cost you a couple bucks for us to give the tranquilizers and stuff.
Yeah.
And I said it'd be safer for our staff, safer for Bruno. And really, they go out of there and clients are like, I wish I didn't have to have this done, but I guess what I'm telling you today, there's 2 ways to do this. You do chill protocol before they come in. That might be the best way. That way that when they come in, they're fine and you may not have to give them the dextometer.
Do clients ever, because I remember this happening once when I worked for you. A lady, we brought her dog back and it was, I think, a husky. You know how loud huskies are. Mm-hmm. And they started drawing the blood and the dog was, and she freaked out and was like, that's my dog that's getting tortured. And she ran in the back.
Yeah, probably.
Does that happen a lot?
Well, there's a door that says you're not allowed
staff only.
Staff only, but they go through the door. And then what happens is, there's just a dog that's vocal. And most of the time it's just kind of, I got a abscess lanced or actually a boil lanced when I was in 8th grade, I think, 7th or 6th grade, I think. And my mother said when she took me to the doctor's house, she said, I hope the whole city of Kalamazoo doesn't hear you when you yell. And I'm like, well, I'll try to be good about it. Well, hell, it hurt. And I could take my pulse out of that thing. It was in the middle of my back or whatever it was. And the doctor lanced it. Anyway.
Ouch.
Yeah. Anyway, it's kind of what it is. But
she thought they were torturing the dog in the back.
I know. That's what they think. But most of the time, we're doing blood work for a reason. Mm-hmm. Yeah. And for the better, for the animal, it's for the good of the animal. And really, in many cases, we're doing blood work to prove or disprove something, and which needs to happen.
So what does it take to muzzle a dog?
Well, in the old days, we used to use gauze and just kind of tie the muzzle shut.
No. I mean, what does a dog have to do to get muzzled?
Usually if it has a history of this, usually what you go back and you gently try to get everything done. And if you can't get it done, then, okay, let's just be safe and put the muzzle on.
You know what I feel like they would muzzle all the time?
What?
Chihuahuas.
Well, there's a reason for that.
Why?
Because a lot of them bite.
Why do a lot of them bite? That's the one thing is I was like, I'd assume coming in.
You have a little dachshund. Dachshunds used to bite. They don't bite as much anymore.
No, they're nice.
No.
She bites me when I blow on her face.
A couple dogs that,
I'll go.
Yeah.
She'll nip right in my face.
Yes, she'll stick her head out of a car window or something.
Yeah, I don't understand it. I'm like,
doesn't make any sense. But anyway, so I guess what I'm telling you is that if you think your dog's anxious about stuff, then we may do Gabatraz or we may do the chill protocol before you come in. And that's just to be easier on the dog, easier on the staff, easier on the owner. Okay. If the chill protocol, if they can fight through that, then they have to have other stuff.
What do you mean they can fight through the medication?
Well, they can just decide.
Damn.
Yep. And we've had a couple dogs like that.
But do you still charge them if it didn't work?
Well, I just charge for what we do. And if it isn't our fault that it didn't work. It's just the dogs that has that sort of anxiety level.
I don't know why I picture have you ever seen when cops tase people and they fight through the taser?
Yeah.
That's what I'm picturing.
Yeah. We don't have a taser or stock prod or anything like that.
No.
Just so you know. But anyway, so
no fun. No, I'm just kidding.
but there's two theories. Is when they're in the room. Well, there's two theories. The most prominent theory is that a lot of dogs are better when the owner's not in the room.
Yeah.
Just like I was better when I was at the neighbor's house.
And you said they don't pay attention.
Well, yeah.
They don't pay attention if the dog's in the room, to what you're saying.
Well, who doesn't pay attention?
The client.
Well, the client. I've said that before. So sometimes if I go back and make a diagnosis, I don't bring the dog up and make the diagnosis with the client room. I make the.
You mean with the dog?
I explain everything. I do the explanation when the dog's still in back. The dog interferes with. If I say, well, you're not going to be able to give him any more begging strips or pepperoni.
They look at the dog.
Oh, he's not going to like that. You're going to be his most unfavored person. I don't hear any of that when the dog's not in the room. Okay. We go over everything a couple of times.
Sensitive topics to say.
We go over everything a couple of times, and then a lot of times I'll write stuff down and I'll give them a cheat sheet to work off when they go home. Here's what, and I always tell them, like, if you were my client, I say, well, this is a Molly problem. What we got here today is a Molly problem.
Not a me problem.
I said,
it's a you problem.
Yeah, it's a Molly problem. And I said, I'll help you with your Molly problem. That's what I'll do. I'll help you with your Molly problem. And then we try to do it. And really, to do a good job, sometimes you have to be able to do your examination. To do a good exam, you're going to you may have to have some sedation on board.
Yeah.
Yeah. And so otherwise you're just,
shooting in the dark.
Yeah, you're just shooting in the dark. Same way with blood work. You go back and do blood work again. I do blood work here. I think we probably ought to do. I had a case like that yesterday. A dog came in, it's having diarrhea. It looked a little bloaty, and I thought, well, maybe this is more than just diarrhea. And it had what they call lymphangiectasia, which is dilated lacteals in the GI tract. And so
lacteals, like,
no, not those.
Oh,
yeah.
I thought it was like a female thing.
No, this is
this is
dilated lymph channels in the GI tract, and so it looks like rivers of cream going through the bowel.
Ew.
And so, yeah.
How do you treat that?
Yeah. Well,
antibiotics?
No, you don't treat it with antibiotics. You treat it with steroids and low-fat diets.
Oh.
Yep. And
is it similar to pancreatitis?
No, not the least bit. It's
okay, but you still treat pancreatitis with low fat.
Yeah, it's a protein-losing enteropathy. So these dogs will have really low albumin because they're losing it in the GI tract.
Oh.
Okay. You can lose it. Basically, you can lose it through three ways: through your skin, through your urine, or through your bowel. And this dog had diarrhea, so it's pretty obvious where it was being lost from. Yeah.
Ew.
Yeah. Kind of crazy.
That is crazy.
Yeah. So anyway, we went ahead and diagnosed this dog, and this dog was easy to do. Went back, had the blood work done, came up, was good to work with. Was a little tender in the abdomen, I think, from all the fluid in the abdomen, but the otherwise.
I think that when they're in pain like that, they're okay with.
Some of them may be looking for help.
Mm-hmm.
Why don't you help me with this? I got a thorn in my paw. I think you've seen that story before. Hey, you take a thorn in my paw and take it out. Hey, you're my friend now. You took my thorn out. Yeah. And so you have to kind of look at things. And the dogs are a lot more, it's a lot more, they're a little smarter than people think they are. And so they may be anxious when they come into where they had their hysterectomy or had their castration. And I guess, who can blame them for having some
thoughts or feelings
some
about
anxieties about that. And then some dogs just continue to get worse as they get older. And then some dogs just finally decide that it's not worth the big stink.
Yeah.
And they'll slow down a little bit. But,
all right. I got one more question for you. Is it harder to restrain cats or dogs?
Probably dogs, big dogs.
Really?
Yeah. They do the alligator roll. Some of them do.
What?
You know what I mean?
I've never seen that.
Oh, haven't you? Oh yeah. They do the alligator roll. They just lose it.
Oh my gosh! I would have figured it's cats.
So when it's the alligator roll, that's the time we look for chemical restraint. If they're just going to sit there and kind of tremble, and I think what the ladies in back try to do, if they got the muzzle on and the dog's trembling about it and everything, we give them a couple of treats afterwards and say, "Hey, you are a good dog today," and so try to make it a positive thing. Mm-hmm. But after having your anal glands expressed, I'm not sure how many treats you got to eat before the treats
before it becomes okay.
Before the treats overcome the anal gland expression. And the nails are the same way. In fact, a lot of dogs, we had a dog at home one time tried to bite your mother when I was doing the nails. and
Which dog was this?
Bandit.
Oh.
So I told Bandit that I was not emotionally stable and that I was going to do them all twice, which I did. And I said, so I would have only done these. We had this conversation with I know that people are thinking this guy's nuts, but I had a conversation with this dog. Hey, listen, doing the nails, maybe one of us is going to die. Doing this, probably isn't going to be me. And so I did them all twice. And he was fine after that. After I did that, I said, well, I just told him, I said, listen, I'm nuts. And you made me angry today. I wasn't mean to him, but I just did all of them twice. And
just traumatizing this poor dog.
No, he was good. He was a smart dog. He was a really smart dog.
Oh my gosh.
But he kind of knew who he could mess with and who he couldn't mess with. Mm-hmm. And he could mess with your mother. He wouldn't mess with me. And but I mean, he went every place with me. Yeah.
That's so funny.
Yeah.
Sage hates getting anything done with her. Nails, bads,
well,
brush.
he doesn't like any of it. He didn't like any of it. He just tolerated it because he knew it was going to happen. And he knew I was emotionally unstable. Yeah.
We all know this.
Oh, yeah. So
common knowledge.
Yeah, common knowledge. But anyway, I think that's the big thing. I think the purpose of this discussion today is that clients need to know there's options for them for sedation. There's options for them for tranquilizers. There's the chill protocol. There's gabatrans. There's gabapentin. People used to use acepromazine, which never worked very well, at least in our practice. And then once the dog, turns the volume up, then there's stuff for the dogs that have turned up volume too, either propofol or dextrometor, things like that you can do it, especially if you're going to take x-rays. If you're going to take x-rays, you need to be able to take x-rays.
Yeah.
And you need to have good views. And
you're not paying for x-rays that look like crap.
That's right. And when you go back and tell them the x-rays were this much, even though they were bad x-rays, well, no, give them good x-rays and then charge them for good x-rays.
That's
and then
right.
Charge them for the tranquilization to do it if you have to. But do what's right for one thing as a veterinarian, do what's right for your staff, do what's right for your patient, do what's right for your client, do what's right for you. And usually all four of you are winners when this all happens. And I know people have anxieties about it, but and don't get too wound up about it. I mean, I see people all the time to bring every once in a while I bring a couple of cats in or something like that. Oh, I was nervous about this today. Mm-hmm. Why? I don't know. I don't know why I was nervous about this today. And really, veterinarians kind of what, veterinarians kind of owe it to their clients to say, I know you're anxious about all this, but don't worry about it.
Yeah,
I mean, it happens all the time.
Fine.
We have a sign we've seen the sign in our lobby. It says how many days it's been since anybody urinated or defecated. 0. Yeah, 0. It's always 0. I keep
Does someone pee in the waiting room every day?
Yeah, every day. Every day somebody poops or pees in the waiting room. Yep.
Oh, yeah.
Yep. And so
the last time I was in there, not the last time actually, because that was yesterday. The time before that, someone's dog defecated in there. And they were like, I'm so sorry. I'm so sorry. And she felt so embarrassed and so bad. I was like, I'm sure this is just another day.
Don't feel embarrassed. It's no big deal.
Yeah.
Okay? It happens.
It happens. Shit happens.
Yep, it does.
All right. You ready to get some outro music?
Sure.
All right, guys. Well, we sure appreciate you guys listening along with us today. We hope that we've been able to share some good information that will help you love your animals as much as they love you. Don't forget, always treat the treatable, prevent the preventable, and we will catch you on the next one.
On the next one. Until the next one.
Until the next one. And when you take your dog in, don't worry, it's not getting tortured.
No, it's not getting tortured. And if you're anxious when you get home, have a glass of wine.
That's right. Yep. Or a beer.